Hi, I'm Jeff, the OT Dude. Welcome to this episode of the NBCOT exam prep course from the OTDUDE Academy. This video will review the Rancho Los Amigos levels of cognitive functioning for the NBCOT exam, as well as OT and family interventions. Let's get functional. So there are 10 levels on the Rancho Los Amigos scale from 1 to 10, often written in Roman numerals. Level 1 is the lowest level of functioning and 10 is the highest and most independent. One thing to keep in mind is that what you review for Rancho's levels will be textbook, but in real life, patients don't actually progress from level to level in a stepwise fashion, and there may be overlap and a gradual progression of symptoms. So each patient is a unique individual and many factors are considered when you assign a Rancho level to them. Each patient may progress at their own rate, depending on factors such as severity, location, time of brain injury, and so on. Some patients may progress through all the levels, while some may not progress and may remain at a certain level. To be successful on the NBCOT exam, you need to know the descriptors for each level. For example, no response and total assist for Rancho Level 1. This will make your life easier because knowing this will allow you to mentally visualize what the patient is functioning at cognitively, how they may be behaving, their alertness and attention tolerance, the ADLs they may be participating in, what their strengths and deficits are, how family can help, and what you should focus on as the OT. So, knowing this actually tells you a lot. If you forgot these titles or descriptors for each level, here are some ways you can sort out this information out in your head. Personally, for me, it took a lot of repetition and quizzing myself until I memorized it. I will show you kind of like a mind map of how I memorized it. One way you can organize the levels is based on assistance level. I made this graphic to show what I mean. Notice how Rancho levels 1 to 3 are total assist, then 4 to 5 are max assist, 6 mod assist, 7 is min assist, 8 and 9 are standby assist, and logically, because 10 is the highest level, modified independent. Knowing that 1 is the lowest level, you already can kind of deduce that it's total assist and 10 would therefore be mod I. So next, notice that levels 2 and 3 are total assist as well. But the difference is that they progress from level 1, no response, to 2, generalized response, and finally 3, localized response. If you're familiar with the Glasgow Coma scale, it has a similar kind of pattern for the motor response part of the GCS. This is awesome because by learning one thing, you kind of learn the other with the GCS and Rancho levels, for those particular parts anyways. It's okay if you are not familiar with the GCS, so notice how in the motor response part of the GCS, you give 1 point for no response. That's nice too because the lowest score for GCS is a 1, and similarly, Rancho starts at a 1 too. So for TBIs, remember that things start from 1. The decorticate and decerebrate posturings can be thought of as the generalized responses because the entire body goes into those body-wide general postures and the patient does not respond to noxious stimuli at a specific location on the body, for example. This is similar to how in Rancho's level 2, it's called generalized response, and Rancho III is the local response, right? Similarly, in the Glasgow, you can give the patient 4 or 5 points for responding to localized stimuli on the motor section. And yes, I highly recommend you become familiar with the GCS as well as how to calculate a GCS score. Going back to the graphic, Rancho levels 4 and 5, as well as Rancho VI on the line, a row above it, they are all categorized as confused. If you were to organize it based on confusion, then Rancho VI would be on the same row as Rancho 4 and 5 as well, as these 3 are all confused. Here's another graphic with the Rancho levels organized based on this instead of their assistance levels. Notice how confused is for Ranchos 4, 5, and 6. By the way, you can download these graphics from the NBCOT exam prep course. I highly encourage you to find patterns so that you can memorize it in a way that makes sense to you, either if it's based on level of assist, presentation, or both. Flashcards are another good way you can learn this too. I also created 2 interactive matching games in my NBCOT exam prep course to quiz you on this information. So you should be able to tell me, for example, that Rancho IV, a patient is confused, agitated, and max assist, but also the other way around too. And to give you a real world example, in the acute rehab unit where I work, the doctor often asks the therapist what Rancho level they believe that the patient currently is at in team meetings. So you should be able to, as well, based on some information, be able to confidently assign a Rancho level to the patient as well. Okay, now let's get into the specifics of each level and OT treatment. The Rancho scale is technically called the Rancho's levels of cognitive functioning. Functioning, we all know the definition as occupational therapists. That involves the actual participation in occupations. But keep in mind that the term cognitive or cognition encompasses many components such as attention, environmental awareness, organization, planning, judgment, problem solving, reasoning, and memory. And not all of these may be necessarily affected for the patient, and each patient may be different. So perhaps certain parts of the cognition may be affected, while others parts and components may remain normal and intact. Okay, so at Rancho level 1, no response, the patient will not respond to the environment, such as to sights, sounds, and touch. Pretty straightforward. At Rancho level 2, generalized response, the patient will begin to respond to the environment, but slowly and inconsistently. Specific responses include breathing, moaning, moving, chewing, and even increased blood pressure, but there is often a significant delay. To remember this, as Rancho level 2 is in the middle between Rancho 1, no response, and Rancho level 3, localized response, you can infer that it's a little bit better cognitively than 1, but not quite level 3, which is more specific in terms of cognition and behaviors for their interaction with the environment. And so cognition is very general or generalized and not that specific. At Rancho level 3, localized response, the patient can react more specifically to the environment, such as turning towards a sound or withdrawing from pain or watching someone in the room. But they are still slow and very inconsistent though. This is a big one for families as patients can begin to recognize, at least to some degree, families and friends. Patients may follow some simple commands such as squeezing a hand or looking at someone, but remember that due to the inconsistency, their responses to even simple yes and no questions are inconsistent as well. So it's important to keep this in mind when interacting with the patient and when you tell families this too. And you don't need to remember different OT interventions for each Rancho level, like specifically each level, but you can instead group them based on several levels at a time. So for Ranchos level 1 to 3 together for OT interventions, these include to prevent falls, such as accidentally from bed, preventing contractures, decubitus ulcers, dysphagia, aspiration, and self-injury, such as from being restrained. You can modify the environment and decrease overstimulation. While interacting, use short and simple verbal cues. With contractures and bed sores, you can modify the bed and wheelchair positioning and components of those, such as upright posture with full support all around. Maintain good skin integrity and muscle tone and incorporate range of motion. Nutrition and hydration are also very important. As TBI is multidisciplinary, educate staff and family about a sensory stimulation program to provide low levels of sensory stimulation. You can educate and support the family about safety for TBI prevention, such as sports injury safety and helmets and things like that, and providing coping mechanisms as well as support groups and resources. You want to avoid early caregiver burnout. More specifically for the family, you want to encourage the family to explain to the patient what they are about to do first. For example, to prepare the patient. Also have the family talk in a normal tone and not to yell. They should also keep their comments short and simple. Limit the number of visitors overall, and basically anyone interacting with the patients to allow the patient to have extra time and to wait for their responses. And whether it's family or staff, encourage plenty of rest breaks. But the key is familiarity, right? So when you engage with the patient, whether it's for topics of conversation, watching TV and the TV shows they would watch, and especially incorporating ADLs such as combing hair and putting on lotion that you think they may have done before. Rancho IV is confused and agitated. Rancho IV is a unique one in that the behavior of the patient is much different than all the rest of the levels, I think. They may be very confused and even frightened as they may not understand what has happened and what is happening around them. They may overreact to stimuli, and because of their confusion, they may be overreactive to the stimuli because of their confusion, and they may react physically as well. Patients may have poor concentration at this level and difficulty with following directions. The patient may be highly focused on their basic needs, such as eating, going to bed, or even going home. They can also be very vocal and screaming, using profanities and abusive language towards others. This can be especially difficult for families who are not used to seeing their family members with this kind of personality, and let alone not being able to recognize the family and friends and interact with them as the way they did before. So the OT can promote simple activities such as self-feeding, dressing, and conversations during this stage using step-by-step directions. The OT and family should also reassure the patient that they are safe by allowing enough movement as is safe. And this may include allowing the patient to move about the room or taking them out as permitted and as safe, of course. Using familiarities such as eating, music, personal items, and family photos may help. Do not force the patient to do things and try to listen to their needs. Remember that they are easily destructible though, so it helps to keep the room with slow stimulation, and this includes a number of visitors in the room at a time as well. Rancho V is confused and inappropriate. The patient now has an attention span of several minutes, but they are still confused and have difficulty understand what is going on around them. They may not be alert and oriented and do not know why they are in the hospital. The patient still requires step-by-step instructions for basic everyday activities such as ADLs. They still often focus on basic needs. The patient still may also be perseverative, easily overloaded, and restless. Family can help by orienting the patient such as to the date and place where they are at, as well as filling in memory gaps. Comments and questions should be kept simple and be repeated with repetition as needed. The family should also continue to allow for frequent rest breaks and to limit the number of visitors. Overall, OT interventions can be grouped for Rancho's level 4 and for level 5, and these include many of the ones from earlier that we mentioned before, such as preventing contractures, maintaining strength, addressing decubitus ulcers, preventing falls, not providing too much overstimulation, and aspiration precautions. Safety is also generally important, but becomes even more so with Rancho's level 4 and 5 because the patient may be agitated and restless and kind of worked up. The OT should take steps then to prevent self-injury and further injury, continuing to minimize overstimulation in the environment as well as with interactions with people and providing instructions. Therapy sessions should be kept short, provide optimal positioning, and maintain the patient's range of motion, muscle strength, endurance, and address tone. There should be symmetry and posture with good trunk control and weight bearing where safe. Address their postural control for, say, bed level and wheelchair level when sitting up. Promote familiar routines for occupations with orientation to self and the environment. He can also continue to provide the same family interventions as, say, for education, safety, coping, and support. Rancho level 6 is confused but appropriate. Their attention span is about 30 minutes now, but they are still easily distractible. The patient may be somewhat confused, but will remember the main points of conversations. They may still get some details wrong though. At this level, the patient often can follow a schedule, but is confused by the changes. They may be oriented such as to the month and year. Although they may have gained some insight such as into their injury, they may still be impulsive and do things quickly. With ADLs, the patient knows when they may need to use the bathroom, and they can do simple things such as brushing their teeth, feeding themselves with help. Family can help by encouraging participation in these activities and cognitively by improving their memory, such as by discussing events, such as what happened during the day or earlier in the day or even last night. At Rancho level 7, the patient can now follow a set schedule and is able to perform routine self-care without help physically, but continue to need supervision due to the cognitive deficits such as, say, attention, memory, problem solving, planning, insight, safety awareness, judging, and rigid thinking. With their memory, they may forget what happens in their day to day or week to week. Overall, their cognitive processing is still slower than before when they were normal. With activities, they may have trouble initiating with follow-through or completing them completely due to these cognitive deficits, especially poor insight and judgment for safety. At Rancho level 8, the patient is purposeful and appropriate. They are alert and oriented. They can complete familiar activities in a distracting environment for short periods. The patient now has new learning. They may be more flexible and less rigid and have some insight into the deficits, such as memory. However, they are still easily overloaded and show poor judgment in new or stressful situations. And as such, they will need guidance in this situation. At Rancho level 8, the patient may now be ready for driving and job training. Also, depression and irritability are common at this level. For Rancho level 7 and 8, the team and family should treat the patient as an adult and provide guidance in their decision making. In other words, the patient's opinions and wishes should be respected. At this level, there should be no need to use simple words, and you should be able to speak to them like they are an adult. But be careful with things like jokes and teasing the patient, as they may not understand them and they may react to those. The patient will still benefit from familiar activities to promote cognitive rehabilitation, including more IADLs. The patient should also be encouraged to be as independent as possible. At these levels, you can also address more psychosocial factors, such as discussing their feelings and talking about negative situations to help them cope, including suicide ideation. Be sure to address safety and restrictions, such as with driving, work, and other risky activities. Prevent deviation from routines and address inappropriate social behaviors. The OT can also incorporate assistive devices and provide activity demands that match the client's cognitive, physical, and psychosocial ability, along as with providing cues as needed. Provide carry-over learning with safety in an environment that is not overstimulating. This includes also fall prevention as well. At Rancho's levels 9 and 10, the patient is purposeful and appropriate, with one difference between the 9 and 10 being that the level assists from standby assist as needed for level 9 and modified independent for level 10, as mentioned earlier. At Rancho level 9, their attention is now better able to shift back and forth between activities. different activities. They still require assistance with problem solving and demonstrate socially unacceptable behaviors. Depression continues to be a concern. The difference with Rancho level 10 is that the patient can now complete activities independently with extra time and compensatory techniques, hence the descriptor modified independent. They can problem solve as well. However, they still require breaks, like rest breaks for fatigue, and are continued risk for depression. OT interventions for levels 9 and level 10 include addressing risky and inappropriate social behaviors, substance abuse, suicide ideation, and depression. Be mindful of the patient's fatigue and overstimulation as well. Cognitively, you should try to restore the patient's executive functioning with planning, initiation, and flexibility in thinking. The OT can promote participation in occupations with assistive devices, memory, and visual aids, as well as by modifying the environment and the activity demands. You should use familiar structured schedules and routines. Maintain the patient's roles, whether it be for family, work, leisure, or so. Promote a healthy lifestyle and educate about the risks of behaviors such as reckless driving and sports. You should continue to promote safety and to prevent falls with, say, dynamic standing balance and higher level activities. Help the patient reintegrate into the community with long-term management and with meaningful goals. Provide support for the patient and family for work skills, financial management, other IDLs, socialization, leisure, and health management. Last, remember to address psychosocial problems such as depression and emotional distress and adjustment to disability. That pretty much covers all the Rancho's levels and the OT interventions, but don't click away from the videos yet. The levels that I would stress and focus are from Rancho's level 4 all the way up to 8, as these involve a lot of the OT interventions and are more likely to be tested on because OT therapy works more often in these levels with patients compared to the other levels. Another thing you can do is to download this table on the NBCOT exam prep course to view at a larger resolution so that is easier to read. I hope you found this video helpful. If you did, give it a thumbs up and share it with your study groups. I'm Jeff, the OT Dude. Thanks for watching and good luck studying.